Osho, you can tell us a bit about yourself, who you are, where you started from, and where you intend to go.
All right, thank you very much. My name is Adamove Osho. I am Nigerian born and raised from Edo State. I first got into public health right after my bachelor's degree, where I worked at the Johns Hopkins, the Institute of Global Tobacco Control. And then, that kind of spurred my interest into public health and understanding how healthcare goes beyond that individual. So I worked there for a while, then I got my master's in public health, focusing on policy and systems. And I came back to Nigeria after that, trying to see if I could apply a lot of that knowledge and experience to, improving our healthcare system here in Nigeria, because we all know that we've had many issues, a variety of issues. We can't start listing them right now. So I did that for a bit. I worked in health insurance for a little while. Then I worked with a public hospital as their public health counsel. And I got a little bit of experience into the day-to-day lives of Nigeria and seeing what goes on and how they value their own health and the kinds of things that attract them to involve themselves in the healthcare system and do or have better healthcare practices. So that was very eye-opening for me. And it even spurred my interest further into figuring out what can be done in Nigeria. And then I met Professor Akintade. He shared his vision for health in Nigeria with me, and I really bought onto that. Trying to create this large impact across the sector, regardless of location, regardless of the ability of the recipients to pay. So I came on board as the program manager, and since then I've kind of worked with Prof, growing the program, getting us to where we are right now. And we're hoping to, which is in about 3 different states and 5 different schools. We're hoping to expand to pretty much as many states as we can across Nigeria, and just trying to see if we can get a lot more people to come on board with that and kind of buy into this vision of making healthcare accessible to every single Nigerian, regardless of whether or not they can pay or their location in the country.
Excellent. It's called Health for Nigeria. It's not a school program.
Yes.
So basically, where do you target? What localities do you target? Would this be in the urban areas or the rural areas? What's your particular target area?
All right. Thank you very much. Yes, the nursing school program is one of the many programs we hope to accomplish using the Health Nigeria organization. So this is the first. We have a few other ones that we're trying to also bring up as we gain some steam with this one. And as you asked, we're primarily targeting rural areas. That's one of the areas where we notice the most need and the least access. So pretty much not like city centers or not areas that have a variety of healthcare access that they can reach out to. It's areas where you have smaller populations sometimes, but then they need even more access to healthcare than areas that are urban. So and also we're trying to work in public schools or public locations, I should say, because then we can assist government programs towards achieving their own healthcare targets or goals. So yes, rural areas with high need.
You've been very successful recently with a few programs in Oyo State and Ekiti State. We want to say we're proud of you. We want to say we've seen a few short videos and a few photos of the program. Tell us what you did in Ekiti State. Tell us from start to where you are now. Tell us from when you decided to go into Ekiti State, who you met, how difficult or easy it was. Give us a storyline on that, please.
Okay. All right. So it could be quite a story, but I'll try to be as succinct as possible.
Thank you.
As I think we spoke a little bit earlier, and I was mentioning that for now our program is funded primarily by well-meaning Nigerians, across the diaspora, not just in Nigeria but abroad as well. So, and sometimes this comes along with a little bit of their own interests, which we're very happy to accommodate, because we feel that if you're going to put in some of your resources towards a program like this, you should be happy and comfortable with the results. And at this point, we don't have any particular kind of separation as to where to begin. It's primarily where we get the interest, where we're able to make the right connections. So Ekiti was interesting because Professor Akintade, the founder of our program, one of his alumni members, she is at the time we first initiated our discussions with Ekiti, she was the permanent secretary at the Ministry of Health. So we reached out to her, we got a meeting, and we kind of explained this program, what we want to do, and how it interacts with health and with education. And she was on board. She gave us some encouragements as well as some support. She was able to write a letter from our office, which we were able to take to the school, saying this is what we want to do. And that kind of started the process. And then coincidentally, one of our funders was also interested in Ekiti State and said they would like to see something there. And we were like, we're talking to them already. We're able to potentially put a school in there. Let's make it happen. So we did that. We met with them. We tried, getting some agreements signed, which we're still on. But that does not stop us from actually starting work there. So we went to Ekiti State, reached out to some of our contacts there, were able to canvass around and try and find some good locations, based off the criteria: rural areas, high need, limited access. So they're able to give us a few locations. We gave this list back to the state. They had their own, inputs. They wanted things to be spread out across the various senatorial districts in the state, which we also think is reasonable, and we can accommodate that as well. So the process kind of flowed that way. We had interest from the state, we had interest from the funder. We had some contacts in the state that were able to do some canvassing for us ahead of time, and then we started, once everything was in place, we started doing our recruitment efforts, which was to find a nurse that would be willing to go to these areas. Because again, we like to have as much impact within the state as we can. So we like to recruit locally. That's for the nurses, as well as find out those that are, if possible, even within that community. It's not possible all the time, and I don't think it was not possible this time around in Ekiti. But they were not too far off, and the nurses were engaged, were willing to relocate to the communities where they are serving right now. So we recruited nurses. We engaged our contractor to assist us with canvassing the school particular that had been selected, which was Methodist Girls High School in Ekiti.
What was the criteria for the selection?
So basically, it had to be a public school, and it had to be in a rural area. And then obviously, once the state gave us their criteria regarding the senatorial zones, we had to limit it so that we're not just focusing in one area and then not taking care of the other areas. But then one thing that was also important was our reception at the school, because when we reach out to them, tell them what we want to do, they would also kind of ask us questions, and we get an impression as to what they feel we'll be doing and how they receive us when we reach out to them, because they're going to be a very integral part of the program too. We can't leave anybody behind. So depending on the reception, how things go with our interactions there, and a few other factors, just how comfortable we are. And then obviously we report this to the funder as well, who usually does not have too much to say regarding what school, as long as it's within their state, or sometimes they even give the school that they want, and then we go out and reach out and try and get the process in there. But for Ekiti, there was not too much of that request from the funder, so we were able to pick a school based off the earlier criteria, and then recruit. Then we had somebody go there and kind of do a needs assessment. What do we need to put in place? Do they need a bed? Do they need 2 beds? Do they need curtains, windows, what kinds of equipment need to be put in there. And then, the process goes on. We procure all of this, we put it there, we set it up. We have the nurses do an onboarding process with us, where we take them through our expectations on the organization, the expectations at the school, and then, they're able to start. And, a couple days or weeks down the line, I'll make a journey down to Ekiti or down to whatever state it is, kind of, do a small launch event to commission the program there.
So tell me, you get to the school, you are allocated a space. What's the first thing you need to do? I suppose it's renovation.
Yes,
tell me how you went through that process of renovating the space. Tell me what equipment you've brought in. Tell me what you need going forward. Tell me what kind of limited, how would I put it now? Limited medical care that you guys deliver. So in the school, for example, you are the initial point of contact with the students, observing COVID protocols. Give us a few details about that. I know we talked about it before I started recording. Please feel free to go to the start of our conversation and narrate all again. This time we have it documented.
Yes, sir. So basically, as you said, we're giving you space. And, the first thing we need to do is a structural assessment. Does this space have, are the walls okay? Is the roof okay? Is the ceilings okay? Are there no ventilation? Just making sure things, especially around like COVID-19, you need to make sure the space is well ventilated, and obviously any structural concerns to be addressed. We've actually had situations where the initial space provided by the school is not sufficient for the program regarding some of our concerns, and we asked them, do you have another space you can give us? We're not asking for a large room or anything too extravagant. You just need a good enough space that's going to limit any need for any real construction work, because we're not trying to build an entirely new building there. We just want to put a space, renovate a space. So basically, after we check our structural concerns, then we start thinking about repainting. Again, for aesthetic reasons as well. You want your space to look decent and presentable. And also, there's a word they use in medical, I guess it's a synonym for clean, just to make it look nice, because it's going to be a medical, healthcare providing facility. And after that, we try to get some furniture in there. Basic furniture, usually beds, medical beds for any patient that needs rest. Most locations now, our basic package, I should say, is 2 beds. We have 2 beds there, and a desk and a chair, of course, for the nurse. Then we're putting any necessary nettings, mosquito nets, and all of that, so that while the windows are open, they can still be protected from mosquitoes and any other insects or bugs that want to crawl in. Then we put in locks to make sure the place is clean, clear, secure. And then we also put in cabinets to house and to keep all our medications that need to be supplied. Then regarding the equipment, we provide a few things: scale, thermometer, blood pressure machine, hand sanitizer dispensers as well are provided. We also do blood glucose and blood sugar checking machine as well. We also put a Snellen eye chart in case the nurse wants to conduct any eye checks for maybe any student or staff she feels is having issues, which is very important for schools, because some students might be sitting in the back of the classroom but can't see what's on the board, and it affects their academic performance. So we also have them have that available at the sick bay as well. Obviously, we'll have mattresses, pillowcases, pillows, all that as well, so that the beds are not just bare. And then our list of medications. I don't have that in front of me right now, but I can provide that for you.
Going forward. Yes. So what you're trying to say is your first point of contact. Any issues, you deliver the first aid. Your nurses are professional.
Yeah.
There are nurses that you've sourced. They have all the basic training, which includes CPR, which includes, like you said,
COVID-19.
analyze, COVID-19 protocols, evaluating eyesight to help the students, and then dealing with the immediate. And then if there was anything more, if it was something that you couldn't resolve, then obviously you would have stabilized the patient before transferring to a bigger health center. Is this correct? Yes. And all this is the initiative of the Health for Nigeria scheme.
Yes, sir.
Quite impressive. How do you source your funding at the moment? What's your funding like, and where do you intend to go with funding? This is probably a chance for you to appeal to people in diaspora.
Yes, sir.
Please feel free.
So I would say the initial start of the program is fully funded by our founder, Osho. He put in his own resources into this, towards hiring myself, getting us off the ground, doing the basic things we need to do to get an organization together. And to date, actually, he still puts in a very decent chunk of our funding, which goes towards program costs, as well as supplementing costs for any of our other needs regarding the nursing school program, which is our initial program now. But then our other primary and probably largest source of funding comes from well-meaning Nigerians and even non-Nigerians actually across the diaspora, people within our networks, friends, families, acquaintances. We reach out as to anywhere as we can, because we feel like a lot of people have this innate need or wants to do something for Nigeria. But every time you hear, if you give to government, they're going to release the money. If you do this once, nothing's going to happen. So we reach out to them and we keep them involved in the process as much as possible, saying, you give us your funding. We're very transparent in what we're doing. We'll give you a step-by-step breakdown of where every single naira or dollar you're giving to us goes, what it's being used for, who is actually receiving that and location. And depending on your own needs or requires, we can also put your name on a school. You can give us some insights as to what schools you want us to go to, what areas you want us to work in. We can do that. But primarily, we're heavily dependent at this time on source funding from Nigerians and non-Nigerians anywhere we meet within our networks, across our contacts. And personally, I've had some friends and family who have also been interested and provided some funding. So we're continuing to reach out as much as we can. As I mentioned earlier, we're still relatively young as an organization. We started in 2020. So we're using this time as we're growing to develop that confidence in our organization amongst the people we've worked with, so that we can eventually get to engage in some larger scale program funders, both nationally and internationally, working maybe with the WHO, with UNICEF, or with DFID or USAID to access some of their international grants if possible. But we've started the processes of trying to see what they require. A lot of times they require an organization to be running for about 3-4 years before they can provide some of the grants that are available. But for now, we're able to get by or manage on what we've sourced amongst our networks, amongst our contacts, and we're using this opportunity to reach out to as many more people as possible who are willing to hear and do something here in Nigeria that will have a fairly, I want to say, immediate impact. Because I go into these schools now and you notice that before they were having 50, 30, 40 students who are missing school a year, multiple days of school a year because of health reasons. But now their parents are more confident to say, okay, we've had something happen. I feel that at school it can be managed properly, and if anything comes up, we will be informed. Our child will be taken care of, and we feel there's no need for them to miss school for something that's minor, even something as small as maybe like diarrhea that a child is having. If the school does not have the right things to manage that, then the parent is not confident enough that their child will be taken care of in school. But that's what the nursing school program is here to do. We're here to say, there's a few things that can occur, and we're able to manage them. That's the first aid basis. And if it gets beyond that, we're in contact with nearby healthcare facilities that can provide the rest of the services that are available for students. You just need to give us the go ahead. You don't need to come and pick them up from school. You don't need to come and take them anywhere. We would handle making sure that they get the best kind of care available to them at the location. So we feel that there's so much impact that the program can have. And people who are aware of these issues around Nigeria, what's going on here, and are willing and able to do something, we're appealing to you. We're growing, and we're sure that you'll be more than satisfied with what we're able to do at any of the locations you are supposed to go to, we are interested in. So that's our funding story for now. But I'm hoping we can have a larger, a better story to tell next time we converse.
Fantastic. Part of what we do at TNN, the New Nigerian for short, is to bridge the gap between diaspora and Nigeria. Trust me, a lot of people in diaspora, we have contact with doctors, we have contacts with nurses, we have contacts with philanthropists that will listen to this small mini podcast and outreach, who I'm sure will want or will be interested in the Health for Nigeria scheme. Our outreach is not as big as we intend just yet, just like the Health for Nigeria scheme. We're an evolving and a growing entity. But I can assure you that all the appeals we've made right now will be going to the right channels. And within the next few months, I'm sure that the Health for Nigeria will make an impact. I, for one, coming from Edo State like yourself, I have a small community in Ovia local government area that will be interested in this scheme, and the New Nigerian is going to try and facilitate the Health for Nigeria scheme within that community. Within the next week and a half or two, I will initiate contact between yourselves and the ESL of the locale. I will initiate contact with you and the school within the community of the ESS choice, and we will start to try and fund a room with enough space, COVID protocols, for us to start the scheme. I'm aware of other people in other areas of Edo State that I'm sure will be interested, who I will push this to once our conversation is finished. The Prince of Osho is he's a pharmacist. He's a potential, I think I can reach out to, who is interested in this kind of schemes as well. And I don't see any reason why he wouldn't want to try and promote this in his own locale. So there's progress. They say every oak tree starts by planting a seed. You guys have planted a seed. You can see that it's growing. You started with one community, now it's growing up to 5 communities. You have testimonials, which we will put together and add to this podcast. So apart from our conversation, the little videos we have, we'll try and stitch it in and edit. Obviously, what I'm saying to you now might not be included in it. But I'm just letting you know that this is where the New Nigerian is going to try and push this Health for Nigeria scheme to. As soon as we finish editing and we start promoting, I'll send a copy to you. I'll send a copy to Professor Akintade. It takes the love of a nation. It takes the love of a people to do what you guys are doing, which makes me a proud Nigerian. which makes me believe that there's hope for our country. And if every Nigerian could just stop for a moment and view the potential we have. You talked about the alumni in Ekiti State who gave you guys audience, the health commissioner. I'm sure I know that person because if it's an Idoani product, I do know that person one way or the other. Now, I know that the resources of federal schools, the resources in the hands of FGC Idoani, the resources of our generation are quite vast, and we will reach out. People want to give back. Day by day, they want to give back. And one way or the other, we will make them give back and we will document. And like you said, even if it's just to put their name on a plaque in front of their scheme, enough recognition. You know, this is all we want. This is what people appreciate. You know, there's nobody I'm going to send this podcast to that will not say good job to yourself and to Professor Akintade. I'm quite sure of that. It's quite obviously Prof is indisposed at the moment because, like he said, he has family ties. But at least he provided an audience in the form of Mr. Osho, who has taken us through the program, how you've gone, where you are. And all I need now to do is make sure that all the every bit of information I have is stitched together, and then we'll push it out there. I would like to go into partnership with the Health for Nigeria scheme, no doubt. TNN, the New Nigeria, is proud to be affiliated with the Health for Nigeria scheme, and we will do our bit, you know. Like I said, and this is a promise, I will initiate contact between Health for Nigeria and the Udo community in Ovia local government area in Edo State within the next week. Now, do you live in Lagos or you live in Abuja?
I live in Lagos right now.
But the problem with Nigeria at the moment is traveling is not secure. You know, I don't know how you guys manage to overcome that. Well, the good thing is there's technology. So I will try and get telephone numbers. You know, these traditional rulers, traditional rulers are very conscious of customs and traditions, you know. So I'll work on that, and then I'll initiate contact, even if it means that you have to travel. We'll talk about travel costs, where you'll be, who to see, and we'll take it from there. Within the next 1 week and a half, we should already start to think of setting up in Udo community that I can provide, you know. Then from there, let's see what other people who we solicit. Let's see what they say. Let's see where else we can push it. You know, I don't know what's happened. Have I lost connection with you? But even if I have, it's not a problem. If you can hear me, thank you for your time, Mr. Osho. So there we are. We see it. People working hard, people trying to deliver for Nigeria. This is a scheme that was formulated in Canada and is suddenly taking root in communities in Nigeria. I appeal to all generous Nigerians out there, people who want to see things work. It's an opportunity to start with a small community scheme, and let's take it forward. Let's grow. Let's see how best we can help our homeland, Nigeria. Yes, there's There's faults, yes, there's problems, but in the same vein, we have good things happening as well. We have decent people trying to make things work for our country. We have areas where this helps are needed, the help is needed. So let us all come together and let's do something to make Nigeria move forward in a positive light, not in a negative light. Every time what we hear is problems, problems, problems. Nobody talks about the good things going on. Take, for example, the Health for Nigeria scheme that's going on right now. Take, for example, the Health Ministry's international taking care of children from various, taking care of orphans, providing education to them. It's a proud thing. It's a good thing. Thank you guys for listening. And we do hope that at some point there will be a part 2 to let everybody know what progress has been happening and where things have gone. I'm most grateful for your time, and we'll take it forward from there at another time. Thank you. Thank you all for the time, and we're most grateful. We're most grateful for your time, and look forward to a better day again. Thank you so much, everyone. Have a good and pleasant day. Bye.